Good day, folks. Thank you for joining us here at Your Health. On today's program, we want to talk about the 12 reasons why you should supplement vitamin B12. Yeah, vitamin B12, nature's most beautiful vitamin and its most complex vitamin we have. The chemical structure is really awesome. It looks a lot like our hemoglobin molecule, but cobalt is in the middle of it instead of iron. Anyway, a little chemistry there for you. It's all about B12 there. You're tired, run down, lassitude, your extremities tingle, or you may not have any symptoms other than you just feel off. Let's talk about B12 today, but first, let's go to our news. Let's see what's happening in the health world. Carrying a cell phone in trouser pockets may seriously affect a man's fertility. New research from Exeter University, published in Environmental International, reviewed 10 previous studies from fertility clinics and research centers involving almost 1,500 subjects. The study's authors state the data strongly suggests that being exposed to radio frequency electromagnetic radiation by carrying mobile phones in trouser pockets may lead to infertility. Most of the world's adult population now carries cell phones, and about 14% of young, middle-income and up couples are infertile. Well, folks, this is a real and growing problem. We are ever exposed to increasing levels of electromagnetic radiation, and carrying cell phones in our trouser pockets may be greatly increasing the occurrence of infertility among young couples. And I don't think this problem is exclusively a male problem, as more women than ever are wearing trousers, and they too carry their cell phones in their pockets. Just last month, a study on cell phone use found talking on a cell phone for more than 15 hours a week tripled the risk of primary brain tumors. Tripled. Now, I want to be perfectly clear on this issue. I am all for the convenience and advancement of personal cell phone communication. I don't want to get rid of cell phones or electrical lines, but we must find ways to reduce our radiation exposure. Our senior citizens will probably be fine, as cell phones are a relatively new thing for us. But what about our kids? They've been raised on these devices and they take them everywhere they go. Plus, they will be exposed for decades. This is for whom I am concerned. Now, one of the best ways to cancel the effects of electromagnetic radiation is to ground yourself when you sleep or when you work on computers or talk on the phone. Please do not discount grounding as a new age scam. The science is sound. Grounding protects from electromagnetic dangers. Most women who have been diagnosed with breast cancer are not getting enough exercise. New research from the American Cancer Society and the University of North Carolina evaluated over 1,700 women diagnosed with invasive breast cancer. They found only 35% of the women met the recommended level of weekly exercise. They also found about 60% of the women reduced their exercise patterns within 6 months of being diagnosed with breast cancer. Multiple studies have confirmed regular exercise improves outcomes in breast cancer. The American Cancer Society, folks, recommends adults, including breast cancer patients, engage in at least either 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise every week. This recommendation includes those with serious disease, such as breast cancer. Of course, it is understandable why so many breast cancer patients do not exercise, as any type of cancer can create immense health and personal challenges while making us feel very, very weak. However, if you can find the strength to put one foot in front of another and eventually work up to a brisk walk 30 minutes most days of the week, you will almost double your chances of beating that dreaded disease. So it is absolutely worth the effort. Sweetened beverage drinkers are getting more fructose than claimed on packaging labels. Researchers from the University of Southern California's Childhood Obesity Research Center evaluated the chemical composition of 34 popular beverages, including all the favorite brands of sodas and sport drinks. They found all the tested beverages contained more fructose than claimed on the packaging label. Sweetened drink manufacturers typically state their products contain about 50% fructose and 50% glucose, a proportion claimed to be typical of high fructose corn syrup. Sucrose, on the other hand, is made from 1 molecule of glucose and 1 molecule of fructose. If these proportions hold true, then sucrose and fructose should both have the same effect on the body. The study found the drinks tested typically contain about 60% fructose and 40% glucose. The study used 3 different independent laboratories, and they used 3 different methods to analyze beverage content. Well, this is certainly amazing, but you know, we Shouldn't be surprised, we've been hoodwinked so many times before by advertisers. Sweetened beverages such as sodas and sport drinks contain more fructose than they reveal on their labels. And that is a problem because our bodies cannot process large amounts of fructose efficiently. Our internal sugar is glucose, and we handle that just fine when taken in appropriate amounts, but not fructose. Our natural diet is relatively low in fructose. Fruit is the major source of natural fructose, and when whole fruit is eaten, the fiber of that fruit delays the absorption and digestion of fructose. But when fructose is added in large quantities to a fiber-free beverage, it overwhelms the liver's ability to process it, resulting in the conversion of fructose to fat, which in turn leads to a fatty liver, and a fatty liver has been implicated as a cause of diabetes. All the beverages tested contained about 60% fructose and 40% glucose, not the 50-50 ratio claimed. In fact, one product claimed it was sweetened with only sucrose, yet it contained 60% fructose and 40% glucose, an impossibility if it really only contained sucrose. Now, I'm positive the food and beverage companies will hotly contest this study's findings, and we, of course, will keep you up to date as the story unfolds. It should be interesting. Well, today in Your Health, we'd like to talk about vitamin B12, the most complex and beautiful vitamin. Stay tuned for more on B12.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Are you sleepy during the day? Many Americans are in a sleep crisis. They aren't getting a good night's sleep, so they suffer from daytime sleepiness. The reason may surprise you. You may be deficient in vitamin D. According to recent research, vitamin D deficiency leads to poor sleep quality. If you aren't sleeping well at night, you are sleepy during the day. Vitamin D and the hormone melatonin are critical to our sleep cycles. Both are tied to sunlight. This is one of the many reasons why working night shift hours can be so hard on the body. So, if you're finding yourself nodding off during the day, before you turn to another cup of coffee, try some of the sunshine vitamin and see how vitamin D can help you get a good night's sleep. For Your Health at a Glance, I'm Dr. Richard Becker. For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-2128. Ask about the AutoShip program for additional savings. Call today.
Welcome back, everyone. It is just so great to be with you today. Well, we will be taking your calls today, so pick up the phone, dial in. We want to talk to you, and today's show is going to be great. We're going to be talking about vitamin B12, nature's most beautiful vitamin. Now, Richard, I don't know about you, but I don't let a day go by without my B12.
You know, I've taken a lesson from you, and I've started doing that too, and it helps. Especially, I notice it when I go to take my daily walk. I have a little more energy to get out there and get my exercise. So there's some real benefits with B12.
Sure is.
Vitamin B12, considered nature's most beautiful vitamin. It has a beautiful ruby red color. This vitamin has a molecular component similar to our hemoglobin molecule and to chlorophyll. You know, chlorophyll's in plants. The difference in these molecules is vitamin B12 has cobalt in the center, hemoglobin has iron in the center, and chlorophyll has magnesium. So we have a green, ruby red, and then crimson red colors. And it all changes because of the mineral in the middle. It's kind of interesting. It is very complex, and the function of B12 in our body is very complex as well. Only bacteria make vitamin B12, and what they make is a form called hydroxycobalamin. Hydroxycobalamin, and that is converted in our bodies to methylcobalamin or to 5-deoxyadenosylcobalamin, and those are the active forms in our body. So bacteria make hydroxycobalamin, and it's converted into the active forms in our body. Most supplemental forms of B12 are what's called cyanocobalamin, and the cyano comes from a cyanide molecule attached to the cobalamin. And when that form, cyanocobalamin, enters our body and it's transferred into the methylcobalamin, a cyanide molecule is released. Now, many people have made a big deal about this release of cyanide, but I want you to know no one has ever died from taking cyanocobalamin. It's never happened. We've never even have a recorded case of people becoming sick from it. So, and maybe they have, but we don't know about it. So what some of the better products out there today, they bypass that whole issue by using methylcobalamin. Okay, that is an active form. We use it in our supplement as well, so you don't have to worry about cyanide. But, you know, I get asked that question frequently, and it's nice to know the truth about that. Okay, so methylcobalamin is a good, safe way to do it, and the better dietary supplements of B12 are made from methylcobalamin. Now, 80% of our vitamin B12 stores are carried in our liver. You know, this is one of the reasons why beef liver is such a good source of B12, because most vertebrates, they store that B12 in their liver. And B12 is a water-soluble vitamin, and yet it can be stored. No other water-soluble vitamin does this. Vitamin C, after 4 to 5 days of no vitamin C, your blood level is virtually undetectable, and you're developing scurvy. Vitamin B12, you can store up to 5 years. 5 years of B12 in your liver. Now, that's a good thing, but it can get us into trouble. And what do I mean by that? Let's say we decide to adapt a vegan lifestyle, a diet that has absolutely no B12 in it whatsoever, because no animal or plant can make B12. Only bacteria can make B12. And let's say we start that vegan diet and we're feeling great because it's a detoxification diet. Okay, and I have nothing against being vegan or vegetarian. But unless you supplement B12, you'll eventually get into trouble being a vegan. So after 3 or 4 or 5 years, you start feeling bad, and you say, well, it can't be my diet because I've been eating this way for years and it made me feel great. Well, it is the way you're eating. You're not supplementing B12. You've depleted all your stores. Now you're developing macrocytic anemia due to B12 deficiency. And this is more common than you might think. So we store a lot of B12. It can carry us through tough times. But if we get into a different dietary practices that don't contain enough B12, it can get you into trouble, and it may be hard to figure out what's going wrong with you. Does that make sense? I hope it does, because this happens more often than people realize. Okay, no animal or plant can make it, only bacteria, and guess which bacteria is famous for making B12? Lactobacillus, the same probiotic type bacteria. There's quite a few different bacteria that can do this, and you know, a cow is very good at this. Their intestinal flora is quite a bit different than ours. They have many of the varying types of bacteria that make B12. They can't get it from the grass diet, the hay diet. They don't get it from that. It completely comes from the bacteria in their intestinal tract, and it super saturates their body, and hence meats are a very good source of B12 for us. In 1934, William Murphy won the Nobel Prize in Medicine for studying pernicious anemia and the role of B12 in blood production. Pernicious anemia is an absence of intrinsic factor. It leads to very poor ability to absorb B12 and eventually powerful anemia that will kill you unless you ingest B12. This was not understood, the exact mechanisms, until Dr. William Murphy elaborated all of this and how it happens, and he won a Nobel Prize for it. Think of all the millions of people his efforts have affected. You know, that's just a profound thing, and I thank you. William Murphy is long gone, but I thank him for his efforts. The body can store up to 5 years. We talked about that type of problem it can lead to, but mostly that's a good thing for us. Now, people over age 60 are at high risk for vitamin B12 deficiency, and up to 42%, depending on cultural diets, location of living, you know, and different types of habits and patterns, up to 4 out of 10, you know, 40% can be quite low in vitamin B12. You know, B12 saturates meats, it's in the liver, this type of thing, but it requires in our stomach strong presence of stomach acid to break all that protein up into its little pieces. It has to be broken up into the amino acids to release B12. Without that breaking up, we can't absorb it. It can be trapped, so if you're not digesting meat well, the B12 is still in the meat, it's not released. Also, this intrinsic factor is made by our stomach. The same cells, the parietal cells that make our stomach acid, release intrinsic factor. Intrinsic factor attaches to B12. Further down our intestinal tract, there's a receptor on the wall of the intestine that grabs that complex of B12 and intrinsic factor and pulls it in, actively pulls it into the intestinal tract. Remember that B12 molecule is big and complex. It's hard for it to diffuse in. It can, but not in high amounts. So pernicious anemia is an absence of this intrinsic factor due to an autoimmune disease that destroys the parietal cells. And so this is what leads to pernicious anemia. So normal processing of B12 requires stomach acid to break free the B12, production of intrinsic factor from those parietal cells, and an intestinal cell membrane that's not inflamed or diseased with intact receptors to pull it in. See, that's fairly complex. Okay, but that's required for this big complex molecule. That helps to pull B12 into our bloodstream. If without the intrinsic factor, we call that pernicious anemia, okay? Low or absent, and in that setting, with pernicious anemia, it's best to treat with injections. Injection B12 is the most reliable way to treat pernicious anemia. Now, what we've learned in recent years is if you're taking higher doses of B12 sublingually, 100 times the recommended daily value, you can get enough into your system from diffusion. But again, the most reliable way for pernicious anemia to treat it is with injections. But what you might find if you have pernicious anemia, if you take a daily sublingual, then you can go every 2 months before getting an injection. That might save you some time and energy, and it might help keep you feeling strong between injections. So there is a role for sublingual vitamin B12 even in pernicious anemia, okay? Now, let's go to our break, and when we return, the complexity of B12, and we're going to simplify this, and we're going to talk about B12 from the perspective of the 12 reasons why you should supplement B12. B12's 12 reasons when we return.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastro defense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. I'm Cindy Becker, and this is Your Health at a Glance. Did you know the typical baby born in America today has over 200 foreign chemicals in their bloodstream? The world is a polluted place, but just how polluted may come as a surprise. Health experts report that pollution plays a major role in the development of ADHD, obesity, cardiovascular disease, Parkinson's disease, ALS, and a wide variety of cancers, including prostate and breast cancer. There are safe and simple steps you can take to lower your exposure to chemicals. Eat an organic, pesticide-free diet whenever possible. Be careful with the home use of chemicals. Don't consume fish that may be contaminated with mercury. Have your water supply tested for purity and add houseplants to lower indoor pollution levels. By taking a few basic steps, we can protect ourselves from disease-causing pollution. For Your Health at a Glance, I'm Cindy Becker.
Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
Bioinnovations brings you Dr. Becker's Bionutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow.
Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net.
We're back, everyone, talking about vitamin B12. Now we're going to talk about the 12 reasons you should supplement with vitamin B12.
Yes, the first reason, no animal or plant can make B12. Only bacteria can do this, and acidophilus is one of those. This makes it hard to get enough B12 by diet alone for most people. I mean, it's become that way, and with our nutrient content of our foods dropping, this is a growing concern. That's the number one reason we can't make it at all. No plant can make it, only bacteria can. Number two, the foods that contain adequate levels of B12 are typically not conducive to a senior's diet. You know, meat is harder to chew. It takes more effort. If you're wearing false teeth or have dental problems, you know, it gets harder and harder. Plus, it is the premium food. It costs the most. Your high-protein foods are at a premium. They cost the most. So living on a limited budget, it tends to be the foods we do the least of. And it's very classic for seniors to develop a tea and cracker type diet, and neither of those have B12 in it, okay? So the foods typically with the highest level, calf and beef liver, extremely high. Fish and trout, this type of food is good. Eggs, liver in general, oysters, scallops, clams. Fortified breakfast cereals is a common way people get their B12, and of course yogurt due to the lactobacillus acidophilus. And you can see that the premium meats, they cost more and harder to chew, okay? So that's a good reason to supplement. Next, nervous system support. Do you have any health problem that involves the nervous system? Anything. Symptoms of B12 deficiency are easily confused with many neurologic diseases. Our B12 helps to maintain a healthy spinal cord, nerve cells, peripheral nerve cells, and brain central nervous system. We can't have a brain, we can't have nerve cells without B12. It's that important. Deficiency leads to symptoms that are common in nerve-related conditions. Now get this, if you're low in B12, you may have tingling in your fingers and your toes. You may have loss of strength. You may notice you're prone to falling. Your balance is poor. You may have gait abnormalities. It's difficult to keep a good gait going. You may have ringing in the ears. You may have numbness very common. And these symptoms are very common with things like Parkinson's disease, Alzheimer's disease, restless leg syndrome, diabetic neuropathy. How about smokers? They're famous for having tingling fingers. Ruptured disc, spinal stenosis, all of these things can mimic, all these neurologic conditions can mimic B12 symptoms, and B12 deficiency symptoms can mimic those. So it is a common phenomena for people to think they have a neuro disease when really they just need B12. And it really comes down to this. If you have any type of nerve disorder, brain disorder of any type, please supplement B12. You might just be amazed how many incurable conditions get better when the patient is properly nourished. God gave us amazing healing abilities, but it is required to have proper nutrition to activate those healing mechanisms. Now, does B12 cure Parkinson's? No, I'm not saying that. But I assure you, if you're well nourished, your disease will be less severe and it will progress slower. And in many conditions, you have been mislabeled as an incurable disease when a proper nutritional approach will cure your disease. That's what I'm trying to get across to you, and I think that's clear now. All right. So many nerve disorders, carpal tunnel, diabetic neuropathy, restless leg, we can go on and on. If you have any of these, please take a sublingual B12 every day. Get on a good, complete, holistic program. We're going to make some progress there. All right, number 4 reason to use B12, supplement B12, because it plays a very powerful role in preserving brain power. We've had a couple studies in recent years that show if you take B complex at a good, strong dose, vitamin B6, B12, folic acid, you half the rate of brain shrinkage in senior citizens. So these B vitamins, including B12, B6, folate, folic acid, they help to preserve brain mass. A shrinking brain is a demented brain. Okay? So to preserve your cognition, to preserve your brain power well into your senior years, B12 should be on that list. Okay? Deficiencies in B12, we're talking about state of mind and mental conditions, can lead to anemia, of course, which is fatigue and lassitude. That's perceived in the brain. Fatigue and lassitude, depression, dementia, and the dementia of B12 deficiency is irreversible. B12 should be thought of as a preventive vitamin, please. Always a preventive vitamin. Don't let it go too long, folks. You may not be able to heal from it. That's what I'm saying. Poor concentration, poor balance and coordination. When you're low in B12, these things will happen to you, I promise you. Confusion and forgetfulness can play a role in stress, anxiety, insomnia, chronic fatigue, any of these problems. Poor mental development in children. If you have any of this, anybody in your family, get them on the B12. Get them on it quickly. You know, add a little vitamin D to that, a little of the omega-3s, a little ginkgo for seniors. That's how you nourish the brain and keep it going. Boy, it really does work. There's many studies on this. So B12, reason number 4, plays a role in our mind and mental function. Number 5, it plays a significant role in energy production. B12 helps us supply our bodies with energy. This may leave you fatigued even after rest if you're B12 deficient. It reduces energy flow to vital organs and it reduces the immune response. The first symptoms are usually fatigue, lassitude, tingling. I get colds one after another. That's a B12 deficiency. It can progress onto a life-threatening condition. But if you're low in energy, think B12. You know, I remember when we would give the B12 shots, and I'd ask, well, what does this do for you? Because I'm always curious. And the most common answer was, well, I have a big week ahead of me, and I need the energy. Give me the juice, Doc. I need the B12. So it really does help with the energy. It's really quite remarkable to see it. Number 6 reason to supplement B12, because proper intestinal function depends on B12. This one's important. Remember we talked about the low intrinsic factor. If you have low stomach acid, you're not going to get enough. When you're low in B12, it creates a scenario of acid-type reflux. It's just like GERD. It's just like irritable bowel syndrome. And what can happen is we take a acid-suppressing drug, and we just learned that when our acid is low, we don't break apart meat to release the B12. So we're taking a drug that will make the B12 deficiency even worse. See, and we can get into this cyclic thing. Deficiencies lead to other problems that compound the problem even worse. Intermittent diarrhea, constipation, heartburn, low acid. This will lead to low magnesium, low B12, and intestinal dysbiosis, all of which alters the bowel flora, which is going to disturb lactobacillus, which will further deplete your body of B12. You see how this works? So any gut problem, could this be B12? I keep having this heartburn, and I'm taking an acid-suppressing drug, which we know will deplete 12. You can get into a tough cycle. So we want to break that. Common gastrointestinal issues that can lead to B12 deficiency: alcohol, not the occasional drink, but a steady pattern of alcohol consumption. Any type of stomach surgery, gastric bypass, weight loss surgery can lead to B12 deficiency. This is very common in bariatric surgery. Any chronic disease that inflames the intestinal tract, such as Crohn's disease, ulcerative colitis, celiac disease, and if you're on any medication that suppresses the absorption of, suppresses the release of acids, H2 blockers, or even metformin for diabetes. These are things, and we'll talk more about that when we return. Stay tuned for number 7 on our reasons of B12's 12 reasons. Have you heard about the health-promoting power of medicinal mushrooms? These remarkable mushrooms include maitake, shiitake, reishi, and ABM. The medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems.
BioInnovations brings you Dr. Becker's Bionutrients Mushroom Complex with maitake, shiitake, reishi, and ABM in one convenient product.
Our mushroom complex features the safest and most powerful medicinal mushrooms available, providing natural support for a variety of health conditions.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Ask about the AutoShip program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. Are you following a low-fat diet? While it's true that too much fat makes us overweight, certain types of fat are actually good for us. Add to your diet omega-3 fats such as fish and flaxseed oil, and omega-9 oleic acid found in olive oil. And reduce in your diet omega-6 found in corn, safflower, and peanut oil, and saturated fats found in meats and whole milk dairy products. Studies show those fats can promote inflammation and chronic disease. The Mediterranean diet can help you make good choices, such as fruits, vegetables, whole grains, lean meats, fish, olives, and olive oil. So remember, increase omega-3 and omega-9 fats. Reduce omega-6 and saturated fat. For Your Health at a Glance, I'm Cindy Becker.
Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
We're back discussing the 12 reasons why you should supplement with vitamin B12. And to help you get the vitamin B12, we have a great special today. The Dr. Becker's Bionutrients Vitamin B12 sublingual lozenge is going to be buy one, get one free today. And that's buy 1 bottle at the regular price, and you get a 2nd bottle free. These are really nice little I tell Richard they taste like sweet tarts. They're little sublingual lozenges that you put under your tongue, but they're very small, and they're really kind of sweet and tart. But I tell you what, they give you the energy that you need.
Yeah.
Now, Richard, I know you have a lot more to go through. We're ready for reason number 7.
Yes.
Why we need vitamin B12.
Well, you know, when we introduced this concept, B12 topic today, we said it's complicated, and I'm trying to help everyone understand the basic reasons. You know, one of the most common early symptoms of B12 deficiency is my mouth hurts. It's like I drank too hot a coffee and I have this scalded mouth feeling, but I didn't drink the coffee hot. So, you know, the intestinal tract symptoms of low B12 and diseases that affect the intestinal tract lead to B12. It creates this cycle that you can really get caught in a trap. So anytime the intestinal tract's upset for any reason, think, could it be B12? Okay, next one. Vital for cellular integrity. Healthy bone marrow. You know, B12 is used to make blood cells. This is our strong constitution. B12 gives us a strong constitution. We need B12 to synthesize DNA and RNA. We need B12 to check the code to make sure it's correct and no mistakes have been made. Okay? This is our code of wellness. This is our genome. Without proper B12, you can't do that right. And you can understand if our genetic code's not right, that could lead to cancer cells too, abnormal cells. Exactly, so B12 is also involved in cancer prevention. It's also used to make fatty acids that make our cell membranes. It's very important. Helps to maintain healthy red blood cells. That's a classic anemia of B12 deficiency. That one's classic. Regeneration of bone marrow products. Blood production is often the first sign of deficiency. The first symptom is usually fatigue and lassitude, okay? Deficiency can lead to, and it does lead to, macrocytic anemia. That means the red blood cell is bigger than it should be. Macro, it's big in size. It also leads to a pale appearance and prone to infection. That's the triad of early B12 deficiency. Macrocytic anemia, pale patient, prone to infections. Number 8 reason to consider B12 as a supplement. It is vital for hormone health. We need B12 to properly control hormone production in men and women. Everybody needs that. As we need vitamin D to do that. The two work hand in hand in controlling our hormonal system. If you're low in B12, you will have a higher than necessary cortisol level. We know cortisol is a stress hormone, right? So B12 deficiency leads to all the diseases associated with excessive stress. Isn't that something? And it's really no more complicated than that, okay? That'll help you remember it. If a woman is pregnant and she's low in B12, she will have a baby who is much more susceptible to diabetes. Also, the child will not have a proper IQ. It can lead to mental retardation. Let's just be frank, that's what it causes if we're not having enough. So, knowing that there's no toxic effect whatsoever to B12, why would you not want to take a little extra B12 during pregnancy, a little extra vitamin D in pregnancy, a little extra fish oil in pregnancy, B vitamins in general. Boy, and probiotics and do the healthy things. Now you're going to have children who are well suited to meet the demands of modern society. You know, winning a scholarship with those extra IQ points are absolutely possible, okay? I think that's what God wants us to do, is to produce healthy, strong children who can deal with this intensely complicated world today. Pregnant and lactating mothers are susceptible to low B12 levels. We're all talking about hormonal related situations. Breast cancers, the majority are hormonally related. They are also known to be low in B12. All right, reason number 9 to consider B12. B12 plays a significant role in the conversion of homocysteine into methionine and heart disease. High homocysteine levels are a major risk factor for cardiovascular disease. If you don't have enough B12, you have too much homocysteine level, too much homocysteine, and what this does is it scars our connective tissues irreparably. And this is probably one of the reasons why B12 dementia can be irreversible. Due to this scarring, changing of our integument, the connective tissues that homocysteine can do. Heart patients with elevated homocysteine levels are at increased risk of heart disease. B12 helps to lower homocysteine. Again, prevention is best in this scenario. Low B12 levels, independent of homocysteine, are also linked to heart rate variability problems, myocardial infarction, and heart failure, independent of homocysteine. So that's a double whammy for heart disease and B12. Number 10, we are often depleted by the very medicines we take. And this is a big one. Folks, don't ever forget, one of the things I hope you remember from this program and all the others that we've made, of all the medicines made in the entire world, all of them, America takes half of them. And yet we're only 3% of the world's population. We take so many medicines, it is not the essence of health. We take too many medicines to the point of complicating our health. There's a time and place for every medicine. Medicines are appropriate at various times, but in general, we take too much. I mean, we have to accept this. Now, the list of medicines that lower B12 is long and extensive, but I want to hit the major ones quickly here. Antacids, anything that lowers stomach pH. Bile acid sequestrants like Questran or Colistid, not your statin drugs. We don't think that lowers. That's CoQ10, okay? But the bile acid sequestrant. Colchicine for gout. Diabetes drugs, metformin, glipizide, and Actos, all three can lower B12. If you're on any of those medicines, please take supplemental B12. Some antibiotics, not short course, but probably the long course. Heartburn medicines, H2 receptors, PPIs, you know, acid-suppressing drugs. Antihistamines, especially if you're taking them chronically. Methotrexate for rheumatoid arthritis, the folate opposition drug. Methyldopa, it's an older medicine for blood pressure. Oral contraceptives and hormone replacement therapy can lower B12 levels, ladies. Some Parkinson's disease medicines like levodopa. Seizure medicines, phenobarbital, primidone, phenytoin. B12 can be depleted, as can vitamin D. Imagine the scenario of low B12 and low D. You're in trouble with that. So if you're taking seizure medicine, please supplement your B12 and your vitamin D. Antipsychotic medications, these are common in nursing homes. Haldol, Thorazine, this type of thing. Sulfonamides for the antibiotic types or the oral hypoglycemic, sulfonamides. Antiretroviral drugs for HIV can deplete B12. And nitrous oxide used for dental procedures and general anesthesia can quickly deplete total body stores of B12. That's our list. Well, we have a few more things to cover. We'll get to that after this break. Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
BioInnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Be sure to ask about the auto ship program for additional savings.
Is our hope for you today. I'm Cindy Becker. When we struggle with disease and painful health conditions, we can become overwhelmed with negative thoughts. We may even develop depression. The Apostle Paul offered guidelines to help us preserve a positive attitude during times of trouble. He wrote in Philippians 4, verse 8, "Whatever is true, whatever is noble, whatever is right, whatever is admirable, if anything is excellent or praiseworthy, think about such things." Thinking positive thoughts is the first step toward overcoming worry, even depression. Proverbs 17, verse 22 reminds us, "A cheerful heart is good medicine, but a crushed spirit dries up the bones." Remember these words of wisdom as you face your health challenges. I'm Cindy Becker. This is Our Hope for you today.
There are thousands of fungal species, and at least 200 of them have been found to cause human diseases.
Fungal infections are common, so what can we do to protect ourselves?
One solution is oregano, a natural alternative. Oregano fights problems created by fungus and yeast overgrowth, and it improves many other health conditions.
At BioInnovations, we offer oregano in gel caps and liquid extract.
yeast and fungal disorders can improve.
So take charge of your health by choosing a natural alternative such as oregano gel caps or oil of oregano liquid extract. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
We're back, everyone, talking about the 12 reasons you should supplement with vitamin B12. And to help you get your B12, well, today is that great special, buy one, get one free, where you buy one bottle at the regular price of Dr. Becker's Bionutrients. This is the sublingual B12. They're really easy to take. You buy one at the regular price, you get a second bottle free. They're just this little tiny tablet that's a sweet tart looking little thing. You put under your tongue and let it dissolve. That's the best way to get it into your system. All right, now Richard, you've got reason 11.
Reason 11, why you should consider supplementing B12 is deficiencies in B12 are often missed by the medical establishment. This is common. You can do a vitamin B12 blood level that shows normal, but you're actually low in B12. The B12 serum level is a good thing to take, but it's not enough, okay? Also, folate or folic acid, either one, treatment with that. And remember, our foods are folic acid supplemented. Folate or folic acid can mask the blood signs of B12 deficiency. Remember how we said B12 causes a macrocytic anemia, the blood cell's big. Well, if you take folate without B12 or folic acid, it will shrink that blood cell down to normal size, trick you into thinking, well, I'm okay. I have a normal B12 level, I have normal sized blood cells, I'm okay. Not necessarily. This is an important point to remember, all right? Must check those B12 levels. Also, a high potassium intake can cause a deficiency in B12. How many people are taking a diuretic and supplemental potassium to compensate for potassium loss? That can cause a washout of B12. Now, how do we test for B12? This is important. You can do a serum B12 level, but you may show normal when you're not. Remember that. But it's still worth doing. You should also do a folate level because folate deficiency creates a confusing picture on top of it. And a complete blood count. In that test, we also look at the blood cells, or the computer does nowadays, to tell if they're big or small. It gives you your hemoglobin level, your hematocrit, and all these parameters of your blood, and that's inappropriate. Now remember this, falsely elevated serum B12 levels are common. It can be liver disease, hep C. That can cause it says it's high, but it's not really, okay? Alcoholism, bone marrow disorders, like leukemia. That's famous for doing that. Lymphomas can do it. Intestinal bacterial overgrowth can give you a false elevation, intestinal dysbiosis, and more. So if you have ongoing health conditions, your blood test may be unreliable. The B12 level may be unreliable. And never accept halfway and down as okay. We want top level B12 or above normal because high levels are not toxic. Remember that. Elevated serum and urine methylmalonic acid or MMA and elevated plasma homocysteine help us diagnose B12 deficiency. I'm going to say it again. We'll have it on the screen for you. Elevated serum and urine methylmalonic acid and elevated plasma homocysteine. Get that with the B12 level. You're more likely to catch it. You can also compare urinary MMA to the creatinine ratio. So urinary MMA to creatinine ratio is highly sensitive for B12 deficiency, doctors and nurses. Also, a new test has come out, the holotranscobalamin. And they're touting this as a new, cheaper, easier, more reliable way to check it with one test, okay? Now, also, we have available for you an excellent book on B12, how to use it, how to spot deficiencies. It's called Could It Be B12 by Sally Patchalock, RN, and her husband, Jeffrey Stewart, DO. It's an outstanding book for patient and doctor alike, okay? If there's any questions on B12, this book will answer it. Well, Cindy, I think we could go to a call. Maybe we'll find somebody who could benefit from B12.
That's right.
All
okay.
right.
Well, you know what?
What's
Okay.
that?
Let's go to Minnesota and talk to Adam. Hi there, Adam.
Hello, Cindy.
Hello, Adam. How are you doing, friend?
Well, I'm doing okay right now.
Okay, talk to me. What's on your mind?
I'm the perfect caller for this subject.
Okay. Yeah, let's hear it.
It'd be B12 right next to me.
Oh, really? I see. Okay. What's the problem?
Well, I've got primary progressive MS.
Okay.
I've recently, a few months ago, been told I've also got osteoporosis.
Okay.
And my symptoms are really bad.
Oh, my. Okay.
I need help.
How old are you, Adam, may I ask?
37.
Oh, you're still a young man.
Yep.
You know, there's a new discovery was made just last week. We've known for many years that low B12 can lead to osteoporosis. Now, I didn't mention that. There's so many details on B12. And they've been able to figure out that mechanism. We didn't know exactly how that worked, but it involves the amino acid taurine. So there's a metabolic cascade of chemical events that require B12 and taurine to have adequate B12 levels. You are also the type of person I want to target because you have an ongoing neurologic disease, MS, correct? And the symptoms of MS, there can be gait abnormalities, tingling, you know, nerve problems can easily be confused with B12 deficiency. Are you seeing a doctor who is well-versed in MS? Have you been checked for B12 deficiency or a vitamin D deficiency, Adam?
Yes, I was checked for vitamin D back in the beginning when I was diagnosed. That was low.
Okay.
I took the 50,000 a week for a while, and then it got back up. B12.
Are you still taking D, though? Are you still taking it?
Yes, 5,000 a day.
Good for you. Okay, what about the B12?
B12, well, I say it was low. The clinic says low normal.
Okay, see, I'm so glad you mentioned that because what we have learned, if you have a neurologic disease, if you have any symptoms even close to what could be a B12 deficiency, having low normal is not normal. You may be on a medicine that falsely elevates that B12. I tell you what, let's do this, Adam. Let's go to our break real quick. Stay tuned with us, Adam. When we come back, let's outline a plan to you that will help boost up your nutrient levels and give your body everything it needs to fight this disease, MS. We'll be right back. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
I'm Cindy Becker for Your Health at a Glance. Do you like to exercise outdoors? Many consider gardening one of life's most rewarding activities. The American Heart Association says gardening promotes a strong heart and it helps to preserve brain mass in seniors. Follow these guidelines so your gardening experience will be enjoyable for years to come. Wear a wide-brimmed hat and protect your skin from too much sun. Wear gloves and sunglasses even on cloudy days. Make your posture strong by bending from the knees. Consider wearing knee pads. Start with small jobs. Set a gentle pace and ask for help when moving heavy objects. Pause frequently and drink lots of water. Whether it's trimming bushes, cutting grass, or growing nutritious vegetables, gardening is a great way to get your exercise and get back to the earth. For Your Health at a Glance, I'm Cindy Becker.
For thousands of years, Eastern health practitioners have used mushrooms for a variety of treatments.
And recently, scientists everywhere in the world have turned to mushrooms in search of health-promoting compounds.
These are known as medicinal mushrooms. Among some of the most potent are ABM, maitake, reishi, shiitake, and cordyceps sinensis.
At BioInnovations, we've made available 4 of the most powerful mushrooms in one easy-to-use formula. We call it the Mushroom Complex. We also offer the amazing mushroom Cordyceps sinensis in a standalone formula.
Cordyceps helps boost energy, an amazing discovery now used in both Eastern and Western medicine. So take advantage of thousands of years of health knowledge.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back. We've been talking with Adam from Minnesota. You know, the further north you live, the more likely you will come down with MS. That was the very first sign that vitamin D deficiency could be playing a role in MS. And it is true. And there are a couple of large trials going on right now to determine what happens when you give high-dose vitamin D to the MS patient. Don't wait for that to come in. Vitamin D is necessary, no matter what they find out in those trials. Keep that 5,000 a day going. Now, our 12th reason to consider B12 is that it's easy, cheap, and safe to do. And this certainly applies to you, Adam. Your level is on the low normal, and that is intolerable in my book when you have a neurologic disease like MS. Get it up to high normal, get it above normal. It's safe, it's okay. Because reason 12, it's safe, it's cheap, it's easy, okay? The most reliable way, again, is to inject it, but taking higher doses orally is also effective. So here's my basic approach to helping people with MS. Number 1, control hormones. And this isn't just a woman's issue. You can help your hormonal situation by using saw palmetto. It's not just for prostate problems, it's to help regulate hormones. Remember, our pollutants affect hormones. That's all I have time to say right now. The world's a polluted place. Next, get all your vitamins up to order in MS. Supplementation is critical. The next is treat any infection. You may have an ongoing infection you're unaware of, sinusitis, dysbiosis, gum disease. Take care of that stuff. We have to do that. It's an unnecessary stress on the body. And finally, detox. Those are the 4 areas: hormone modulation, vitamin replacement, control infections, detox. Heavy metals complicate and can worsen MS terribly. You need vitamin D. I'm going to send you some. Keep up that 5,000. I'm going to give you the B12 sublingual. Do 2 or 3 a day for at least a month, and then go down to your 1 or 2. Get that B12 level up. Fish oil will be coming your way. Saw palmetto will be coming your way. Curcumin is amazing for any neuro distress. Curcumin. It's a great chelator, detoxifying agent. Olive leaf extract, helpful if you have any yeast problems. Active adult multiple vitamin and mineral powder, noni juice, because the spasticity of MS can give you considerable musculoskeletal pain, and magnesium makes everything work better. Magnesium gel on the skin, magnesium chelate internally, and even Epsom salt bath. Combining these things together. I'm going to send Better Brain book and a book from Dr. Russell Blaylock, Health Secrets You Must Know. And these are all helpful things that will help you deal with your MS. Well, honey, thank you so much for the buy one, get one free. We call them BOGO.
That's
buy
right.
one, get one free. That helps make it more affordable so people from all walks of life can have better health.
That's right.
Can it be B12? You bet it can. Supplement it for better health. Use it in prevention. Folks, thank you so much for your kind attention and support of your health. We'll see you tomorrow, everyone. Bye-bye.
Thanks, everyone. We'll see you right here tomorrow on Your Health. Bye-bye.
In the pit of my stomach, I knew it was going to be positive. I wouldn't be in this situation if I would have even been taking it if I didn't think it was going to be positive, but I didn't want to admit that. I turned it over, and there were 2 lines. It was a positive test. I remember just being like, oh no. Like, that was all that really went through my head. I didn't know what to do.
Hear the stories and experience the freedom on Real Life.
This week on Our Jewish Roots, we begin our examination of the kings of ancient Israel and Judah in our series, Kings and Kingdom, with dramatic reenactments Bible teaching from Dr. Jeffrey Seif. Watch for kings and kingdoms.
Rejoice in the Lord always.